It's a beautiful day down here at the Bob Bowling Training Donktor's Inn. Today we're going to run through Epi, and then we're going to run through our pump operations on how to do an Epi infusion and work our way into our Esmolol infusion as well. We'll start off with Epi 1-to-1 and making cardiac Epi, which is what we get prepackaged in a box that looks like this. But in the case that we don't have this for supply chain issues and stuff like that, we can make it out of our 1-to-1. We do that through the push-pull method, where you push 1 ml out of a normal saline flush and then draw the 1 ml out of your 1-to-1 amp. So you dump your liquid out of your 1-to-1 amp, crack it, get you a blunt tip draw needle. You can use a regular needle as well, you just have to use a lot more caution. Now I'm pushing 1. When I'm pushing that 1 out, I'm making sure I push to the number 9 on that flush. Come back over here, and I'm going to draw back to the number 10. And I've now created Epi 1-to-10, which is the cardiac dose of Epi that we're familiar with that comes out of the box. Now, if I want to make push dose Epi out of this, I can do that as well. So with this being 1-to-10, it's push 1, pull 1 again. So I'm pushing 1 out of this, down to the 9. Now the pull's a little different on this. You got to get tricky with it on pushing it back into it. So I'm at 9, drawing back to my 1, carefully inserting into the top of my syringe, and I'm injecting 1 ml in there, making Epi 1-to-100,000, which is our push dose Epi. Now once you've got your push dose Epi, you can give this 5 times. It's 10 micrograms per push, so you can do that once every 5 minutes by pushing the 10 micrograms in each ml in, titrated to effect on your blood pressure. So that goes through that. Let's go through how to make our cardiac infusion Epi. So as we know, if we're running a cardiac arrest, we got a non-shockable rhythm, or until we confirm that it's non-shockable, everybody's getting 1 bolus of epinephrine 1-to-10. So you're one and done with that. At that point, you're going to set up, if it's a non-shockable rhythm, for your Epi infusion. Now to make your Epi infusion, you're going to take 2 boxes of your Epi 1-to-10, which will be a total of 2 milligrams. Take these out, pop your tops, get you a needle on. I don't have a long enough draw needle, so I'm using a regular needle with caution. Put this together. I'm coming to the white side on my bag, which is your injection port. You're going to be injecting this into a 250 bag of normal saline. So I'm putting 1 round of 1-to-10 in. Simply unscrewing the amp from the actual syringe, cracking my next box, popping the top on it, and injecting my second round into that 250 bag. Now, if you don't have a pump on scene, we have the option of running this dirty. And to run dirty, it's 9 drops every 6 seconds, which is technically about a TKO rate, which will last you about 30 minutes. So if you're going to run dirty, you're going to use a normal pump set. Spike the bag as you normally would. Flush your line with your medication. Spike our bag in the blue port. If you've got a multi-select dial on this, make sure you're running 10 drops a second on it. Flush line as you normally would. Give it a squeeze so you can see where you're at. And you can run that dirty by titrating this down to about 9 drops every 6 seconds, which is about right there. Run that as long as you're in a non-shockable rhythm. Once you get into a shockable rhythm, you're going to want to switch over to your antiarrhythmic ladder, which is your amiodarones, climbing up into your Esmolol, and we'll go over how to infuse those and how to calculate your dosages on that. Now, if you have a pump on scene and you're going to run your Epi through your pump, you're going to want to DC your normal drip set. And you want to get one of these pump sets, which you carry in your medic bag, or they'll have with MedStar. Same process for spiking the bag into what would be your blue port. One of the important things to remember is to flush this line with your medication, because we are giving micrograms. We don't want to be giving micrograms of saline expecting an effect from it. So once your line's flushed, you can either use the stopcock on this, which it has, or you can use this toggle right here. When this toggle's out, this circuit's closed, so nothing will flow through it. When you push that toggle in, it's spring-loaded. You can see the bubbles moving. That allows flow to come through it. So now that our line's flushed with our medication, we can go into the pump. These Sapphire one-channel pumps are pretty easy to use. You'd hit your on button. You'll get a screen that pops up. It's going to run a system check. All right, after it runs its system check, it's going to let you know what clinical care area you're in. We always want to be in the field library. If for whatever reason this says CCP right here, you're going to go to your touch screen and hit change. You'll see that it says CCP or field. Always run from the field library. Then you're ready to start a new infusion. We're just going to use Epi as the example here. So when you get here, it's like an old touch tone telephone. Double D gets you to E. Find. We would be running Epi. That would be the concentration we're running. Dose rate for Epi would be 67 micrograms per minute. Volume to be infused after you pre-mixed your Epi bag, 250. Ooh. That time will be calculated by the pump at 29 minutes and 51 seconds. Hooking up your drip set, you're going to open this door on the side. Two little hinge points on the side of your pump set here. There's an arrow that points down. That's down towards your patient. You can hinge this in. You'll notice this channel button's open right here. As you push down, it closes that and opens your channel. There'll be a small click. You'll pull this down to where you can shut the door. And at that point, you're ready to run through your check screens and start your infusion. Always want to make sure that you flush this line with your medication, not just normal saline. And at that point, you're able to run your infusion. Again, this Epi infusion only runs while you're in a non-shockable rhythm. If you get to a point of VFib or a shockable rhythm, you want to discontinue this, move over to your antiarrhythmics. So as we talk about antiarrhythmics, say we're running Epi on a non-shockable rhythm, we're shutting that pump down, letting them run through their next cycle of CPR, and at the second shock, we are good to give our amiodarone. Our first round of amiodarone is 300 milligrams. To get 300 milligrams with our current concentration, it's going to take you 6 mLs. So you'll need at least a 10 ml syringe to do that. You're going to pull both of these up, administer your 300 milligrams of amiodarone. And then at the third shock, you're going to administer 150 of amiodarone by drawing it up, administering it. And then at that point, you're able to move to your esmolol. Esmolol is usually ran up until the point we get ROSC. Remember that esmolol, like most of our LOL drugs, is a beta blocker, and eventually it's going to do its job and lower the blood pressure. So if your blood pressure is not over 100 systolic, if your blood pressure is over 100 systolic, you can run this. If it's not over 100 systolic, you need to shut it down. So be prepped to shut this down once you do get ROSC. You're just going to be fighting yourself on trying to get a blood pressure up. So to run the esmolol, your dosages for it is 0.5 for your bolus. That is weight-based. There's a weight-based chart for it. I'm going to say I'm running a 110-pound patient, which is going to equate out to 50 kilograms when you do your division by 2.2. Your chart's going to show you that for a 50-kilogram patient, it's going to be 25 milligrams. To get 25 milligrams, you're going to pull a bolus of 2.5 mLs. This comes pre-mixed. It's carried by MedStar or Medic 1 units. It's pretty expensive, so don't preemptively mix this up until you've climbed that antiarrhythmic chain. We don't ever just jump to esmolol for our next line antiarrhythmic. So I'm going to come over here. I'm going to get me a draw, one of my draw port. For a 110-pound patient, I'm going to double check my math. It's going to be 2.5 mLs for a 25 milligram bolus. Drawing up 2.5. I'm going to drop that into my patient and immediately start my Esmolol drip. So for your Esmolol drip, take our epi drip out. You would have new tubing for this. You're going to start your pump just like you did for your epi infusion. Turn it on, let it run its system check. Double D will get you to E again. Find Esmolol. That's the concentration it's provided in. Say our patient weighs 50 kilograms. Dose rate for an Esmolol infusion after you give your bolus is 0.05 milligrams per kilogram. So 0.05 is entered. It's back. 0.05. Volume to be infused would be 250. Time is 16 minutes and 40 seconds. Same on hookup procedure. Hinges towards the bottom over your hinge point. Arrow down towards the patient. Channel's open once you push in and it locks. Pull. Close the door. Okay. Run through your check screens. And you're now ready to start your infusion. Again, that infusion is going to run after you've climbed your antiarrhythmic ladder, you've used your 300 of amiodarone, your 150 of amiodarone, and then moved into Esmolol. You want to pay special attention to your blood pressure because Esmolol is eventually going to do its job and drop your blood pressure as a beta blocker.